Did you know that patients that receive a vaccination around the time that they're getting dermal filler are at risk for a delayed inflammatory reaction? And by convention, a delayed reaction is anything that happens 14 days after the dermal filler treatment is completed. But these events can happen months and even years later. It's important to know that these events are rare, and the benefits of vaccination often outweigh any risks associated with the dermal filler treatment. But for those of us that are actively engaged in the facial injectable field, these rare events might not seem as rare as we'd like. There's a growing number of reports, and even some systematic reviews are emerging that describe the connection between the vaccination and these delayed inflammatory reactions that happen after dermal filler. This isn't really a new phenomenon, but since COVID, the world's experienced a large-scale participation in vaccination and boosters. And with greater adult participation in vaccination, we as injectors are seeing these inflammatory reactions in our aesthetic practices. While the exact mechanism of how these events occur is unclear, they're probably immune-mediated and multifactorial in nature. And we do know that there's a number of triggers that are also associated with these events. And these can include infections, both viral and bacterial, the use of low-quality products, combinations of different products, poor technique, and past and current dental procedures. Now, vaccines are designed to stimulate our immune system, so it makes a lot of sense that they could play a role in these delayed inflammatory reactions. And we also know that despite their excellent biocompatibility, hyaluronic acid-based fillers do elicit a mild inflammatory response when they're initially placed. We also know that certain individuals might be susceptible to these adverse events because of pre-existing medical conditions, and age can play a role. And research is also emerging that points to certain areas of the face that might be more susceptible than others to these inflammatory responses. But unfortunately, we don't have any consensus data yet. So at this point, practitioners are left to use their best clinical judgment to decide if a patient is healthy and immunocompetent before performing an aesthetic elective procedure for them. Essentially, this is a diagnosis of exclusion, because certainly when someone presents with some sort of inflammatory response, the first thing we want to do is rule out that it's anything infective. And once infection has been ruled out, the practitioner has to consider that this may be a delayed inflammatory response. The next course of action is to ask the patient about their vaccine status and the date of any last vaccine or booster. While we don't have any consensus that provides us with guidance on how to avoid these potential adverse events, there are some experts that are recommending that a patient wait between 2 and 3 weeks before and after dermal filler treatment to have any sort of vaccination. So again, it would seem wise to stay within that community standard until we have better direction from the scientific community. There's several proposed mechanisms by which we can treat these manifestations when they occur, but again, no definitive guidance. ACE inhibitors have been used with some success. Some experts recommend a wait-and-see approach for the very small and painless nodules to see if they resolve on their own. But for me, since these are presenting on a patient's face and they're usually pretty upset about it, I want to do something about it. So once I've determined that it's not infective, that it's probably inflammatory, I go ahead and dissolve this with hyaluronidase. And empirically, I will say that in my experience, the earlier in this process that the filler is dissolved, the faster the patient gets resolution. Again, practitioners that do a lot of these procedures, whether they know it or not, they're seeing these cases. I had a case where a patient presented with an inflammatory reaction 2 months after I'd given her under-eye filler. When I questioned her about her vaccine history, she recalled that she had had a COVID booster 2 days prior to our appointment for dermal filler treatment. I wound up dissolving the product with hyaluronidase, and the patient resolved completely. As practitioners, it's so important that we continue to educate ourselves about the treatments we provide. This means following the literature, and we should also educate our patients about potential risks. Having this conversation with the patient early in the treatment planning phase can help eliminate that terrible disappointment when the patient shows up, they're ready for their treatment, they've had a vaccine in the last few days, and now they have to reschedule. I've actually added this to my patient scheduling portal. It advises my patient to plan their dermal filler treatment outside of a 2-week peri-vaccination window to help reduce the risk of one of these inflammatory reactions.